So there is a various reason for hip pain. Some are related directly to the joint itself. Some are for reasons surrounding the hip joint. And some other pains can be referred to the hip. For example, back pain can shoot to the hip and present itself as so-called hip pain. The art is here to find the source of the pain and then see what can be best done about it. First of all, the diagnostics is important, and often the clinical examination gives us most of the answers. I would say in about 2/3 the information is basically clinical, but often we require further additional tests in way of, for example, X-rays or MRI scans, ultrasound. They're all available in a wide spectrum at Blackheath Hospital in a timely fashion. And so once we discuss the best diagnostic options and the diagnosis is established, there are different ways of managing those. Physiotherapy is a main base of treatment for orthopedics, targeted physiotherapy. The treatment sometimes includes injection therapy in way of steroid injections or viscosupplement injections to lubricate the joints. These can be applied either in the clinical settings or sometimes image-guided by radiological colleagues. And then the last resource would be the surgical approach where required, and again, the details of which will be discussed and with you, the patient, to center you in the decision making. So a lot of sports people develop, unfortunately, repetitive injury to the hip rather than a sudden act of injury. And repetitive strain to the joint can be often addressed with activity modification and targeted physiotherapy exercises. And if that is not sufficient, then we would discuss escalating the treatment options to more interventional orthopedic procedures such as injections or as a last resort surgery. The recovery period following surgery varies depending on the procedure required, but also the circumstances of the patient. People heal at different rates, and it also depends on how interactive the rehab process is. The positive aspect about Blackheath is that they have a very strong physiotherapy department, and they can curtail the treatment to the patient's requirement, have out-of-hour timing for the procedures, including weekends, so they can adjust the management much more patient-focused in a targeted way.